Bay Area fog. In the early Cold War, the U.S. military was developing biological and chemical defense strategies. Part of that effort involved vulnerability assessments, specifically testing whether American cities could be targeted by airborne biological agents. Between September 20 and 27, 1950, the U.S. Navy conducted a classified operation called Operation Sea Spray. A ship traveled along the San Francisco coastline and released aerosol clouds containing Serratia marcescens and Bacillus globigii, two bacteria the military had classified at the time as harmless simulants. This operation is confirmed in declassified Army documents and was formally acknowledged during 1977 Senate hearings on the Army's biological testing program. The Army disclosed that it had conducted over 200 open-air biological simulant tests between 1949 and 1969. Sea spray was one of the earliest. The Army and Navy have maintained that the bacteria used were, to the best of their knowledge at the time, non-pathogenic. The 1977 Senate report accepted this position. The 1981 federal lawsuit brought by Edward Nevin's family was dismissed on the grounds that the government could not be sued for discretionary military decisions. What the documents do not resolve: whether the cluster of Serratia marcescens hospital cases in the weeks following the test was connected to it. The Army's own internal records acknowledged the temporal overlap, but did not conduct a formal epidemiological study linking the two events. The causation question was never investigated in a controlled, independent manner. It remains, in the formal sense, unresolved. The program. The early 1950s saw significant American intelligence investment in what was broadly called mind control research. This was partially driven by reports from the Korean War that American POWs had made public statements appearing to contradict their known views, behavior that U.S. analysts attributed to communist brainwashing techniques. In April 1953, CIA Director Allen Dulles formally authorized a program called MK Ultra. Over the following 2 decades, the CIA funded and conducted experiments involving hypnosis, sensory deprivation, psychological manipulation, electroconvulsive therapy, and, most extensively documented, the administration of LSD to human subjects, many of whom were not informed they were participating in a drug experiment. Subjects included prisoners, mental patients, drug addicts, and in some documented cases, ordinary citizens. One of the most documented individual cases is that of Frank Olson, a U.S. Army biochemist who was covertly dosed with LSD in 1953 and died 9 days later after falling from a New York hotel window. His death was ruled a suicide. MK Ultra's existence became publicly known after CIA Director Richard Helms ordered the destruction of most project files in 1973. A surviving cache of approximately 20,000 documents was discovered in 1977 during a FOIA request. These documents confirmed 150 separate research projects conducted at 80 institutions, including hospitals, universities, and prisons. A 1977 Senate Select Committee formally investigated and reported on the program. The CIA acknowledged the program was improper and violated ethical standards. CIA Director Stansfield Turner testified before the Senate in 1977. The government settled civil claims brought by some victims and their families. President Ford's 1976 executive order prohibiting human experimentation without informed consent was partly a response to these revelations. Because Helms ordered MK Ultra files destroyed before the investigation began, a complete accounting of all subjects, dosages, and institutions has never been possible. The Senate acknowledged this explicitly in its 1977 report. What survived was likely a fraction of the total program documentation. Frank Olson's case remains specifically notable. His family commissioned an independent forensic examination in 1994 after his body was exhumed. Forensic pathologist James Starrs concluded the injuries were inconsistent with a simple fall and suggested the possibility of a blow to the head prior to impact. The New York District Attorney's Office reviewed the case but did not pursue charges. No definitive official determination of what happened to Frank Olson has ever been issued. Atomic observers. Following the atomic bombings of 1945, the U.S. military undertook an extensive program to understand nuclear weapons and their effects, including the effects of radiation on personnel, equipment, and naval vessels. Operation Crossroads, conducted at Bikini Atoll in 1946, involved 2 nuclear detonations observed by thousands of military personnel. In the years that followed, through the atmospheric testing program at the Nevada Test Site and the Pacific Proving Grounds, an estimated 400,000 to 500,000 U.S. military personnel participated in nuclear tests in various capacities, as observers, technical staff, or soldiers conducting maneuvers near detonation sites. In some documented exercises, infantry units were positioned in trenches a few miles from ground zero and ordered to advance toward the detonation point shortly after a blast, as part of studies assessing combat effectiveness in a nuclear environment. These activities are documented in Army records and have been the subject of multiple Veterans Administration studies. The Defense Nuclear Agency compiled registries of nuclear test participants. Congress passed the Radiation-Exposed Veterans Compensation Act in 1988, acknowledging the connection between test participation and certain cancers, and creating a compensation program. The military has maintained that, at the time of the tests, the full health risks of radiation exposure were not yet established. The 1988 Compensation Act and its subsequent expansions represent a formal acknowledgement that exposures caused harm, even if the full causal chain was not known in real time. The government's own nuclear test personnel review records contain significant gaps in dosimetry data, the measurements of how much radiation individual service members received. For many participants, individual dose records either were not kept or have not been located. Veterans advocates have argued for decades that the absence of these records has made it difficult for individuals to qualify for the compensation programs created specifically to address their exposure. The Defense Nuclear Agency's own 1985 report acknowledged that personal dosimetry data for a substantial portion of test participants was incomplete or unavailable. Bad blood. In 1932, the U.S. Public Health Service, in collaboration with the Tuskegee Institute, began a study in Macon County, Alabama, to observe the natural progression of untreated syphilis in a cohort of black men. The study was originally framed as a limited, observational project. The study enrolled 399 men with latent syphilis and 201 uninfected controls. Participants were told they were being treated for bad blood, a local colloquial term for various ailments, and were offered free meals, free medical examinations, and burial insurance in exchange for participation. They were not told they had syphilis. Critically, when penicillin became the established standard of care for syphilis in 1947, the men were not offered treatment. The study continued for another 25 years. The study ran until 1972, when a whistleblower named Peter Buxton, a PHS venereal disease investigator, leaked information to the press. By that point, 28 men had died directly of syphilis, 100 had died of related complications, 40 wives had been infected, and 19 children had been born with congenital syphilis. These figures are from the final accounting by the CDC, which inherited the study. The U.S. government has formally acknowledged the study as unethical and a violation of participants' rights. In 1973, a class action lawsuit resulted in a $10 million settlement. In 1997, President Clinton issued a formal public apology to the 8 surviving participants. The study directly influenced the creation of the National Research Act and the Belmont Report, which established core principles for ethical human subjects research. What the official record has not fully addressed is the internal decision-making between 1947 and 1972, specifically the documented discussions among PHS officials about why the study continued after penicillin became available and known to be effective. The documentary record of who specifically decided to continue after 1947, on what grounds, and with what formal authorization, is not complete in publicly available records. Invisible clouds. In the late 1950s, the Army continued its biological and chemical simulant testing program, which it had been conducting since the late 1940s. These tests were part of an effort to understand how airborne particles might travel across large geographic areas, information relevant to both offensive and defensive biological warfare planning. Between 1957 and 1958, the Army conducted Operation LAC, Large Area Coverage. A series of aircraft flights released zinc-cadmium sulfide particles over large portions of the United States and Canada. The flights covered areas including Minneapolis, St. Louis, and the corridor between Winnipeg, Canada, and Detroit. The particles were fluorescent and could be tracked with UV light, allowing researchers to map dispersion patterns across hundreds of miles. The Army acknowledged Operation LAC in response to a 1994 National Academy of Sciences review that the Army itself commissioned. The NAS report confirmed the scale of the testing and the use of zinc-cadmium sulfide. The Army's own data indicated that cumulative exposures in some residential areas may have exceeded what would later be considered acceptable thresholds under modern occupational safety standards. The Army has maintained that zinc-cadmium sulfide was believed to be safe at the time of testing, and that exposures during the operation were too low to cause health effects. The National Academy of Sciences' 1997 follow-up report concluded the risk to the general population was probably low, but noted that cadmium, a component of the compound, is a recognized carcinogen at higher doses. The 1997 NAS report explicitly noted that the Army did not keep records of which specific neighborhoods or residential areas were overflown during the dispersion tests. Without location-specific exposure data, neither the Army nor independent researchers can assess whether populations in high-deposition areas experienced elevated rates of cadmium-related illness. That data was either not collected or is not available. Crew unaware. During the 1960s, the U.S. military conducted a series of classified exercises to test the vulnerability of naval vessels and their crews to biological and chemical agents. This program, known as Project SHAD, Shipboard Hazard and Defense, involved exposing naval ships to simulants, and in some cases, actual biological and chemical warfare agents. SHAD involved dozens of tests between 1963 and 1969, conducted primarily in the Pacific Ocean and off the coasts of the Bahamas and Hawaii. Ships were exposed to aerosols containing agents including VX nerve agent, sarin, soman, and various biological materials. Crew members were typically not informed of the specific agents being tested. Medical monitoring during the tests was, according to later congressional testimony, inconsistent. The Department of Defense formally acknowledged Project SHAD in 2000, following years of veterans lobbying Congress after experiencing health problems they attributed to their service aboard test ships. The DoD subsequently declassified 113 individual test reports. The VA was directed to extend healthcare eligibility to SHAD veterans, acknowledging the possibility of health consequences. The DoD's position has been that the tests were conducted as part of legitimate defense research, that many agents were used at low concentrations, and that health effects attributable specifically to SHAD participation versus other service-related factors are difficult to isolate. The VA has acknowledged this ambiguity while extending benefits. The DoD's own declassified SHAD documents note that real-time medical monitoring during many tests was minimal or absent. Veterans who served on SHAD test ships have reported a range of neurological, respiratory, and immune-related conditions. No definitive epidemiological study isolating SHAD participants as a cohort has been completed and published. Captive subjects. From the early 1950s through the early 1970s, the University of Pennsylvania's Dermatology Department, led by Dr. Albert Kligman, conducted research at Holmesburg Prison in Philadelphia. The stated purpose was product testing, pharmaceutical compounds, skin creams, and other materials, in a controlled institutional setting. The scope of what was tested at Holmesburg extended considerably beyond dermatological products. Declassified documents and subsequent investigative reporting, primarily by journalist Alan Hornblum, whose 1998 book drew on declassified Army records, revealed that inmates were tested with psychoactive drugs, dioxin, radioactive isotopes, and, under contract with the U.S. Army, chemical warfare agents, including a compound related to the hallucinogenic agent BZ. Inmates received nominal financial compensation. According to records and survivor testimony, the nature and risks of the experiments were not clearly disclosed. Army contracts with the University of Pennsylvania for chemical agent testing at Holmesburg are documented in records released through FOIA requests. Dr. Kligman later acknowledged in professional publications that Retin-A, which became a commercially significant dermatological treatment, was developed in part through Holmesburg research. The U.S. Army's involvement in pharmaceutical and chemical agent testing at civilian prisons during this period is confirmed in the record. The University of Pennsylvania has expressed institutional regret for the experiments. Philadelphia city officials held formal hearings in 1998 following publication of Hornblum's account. No criminal charges were filed. By that point, the applicable statutes of limitations had passed. The full scope of Army contracted testing at Holmesburg, which specific agents, which dosages, how many subjects, has not been established from available documents. The FOIA releases are partial. What is known from the Army contracts is that testing occurred. The complete experimental records from those specific contracts have not been made public in their entirety. Desert injections. In preparation for Operation Desert Storm in 1990 and 1991, U.S. military personnel were administered a series of vaccines and prophylactic medications intended to protect against potential biological and chemical threats, including anthrax and the nerve agent protection drug pyridostigmine bromide, known as PB. More than 697,000 U.S. service members deployed to the Gulf region. In the years following their return, a substantial number reported a cluster of symptoms: cognitive difficulties, fatigue, muscle pain, neurological problems, that became known collectively as Gulf War illness. The Department of Veterans Affairs has estimated that approximately 1/3 of Gulf War veterans, somewhere between 175,000 and 250,000 individuals, report symptoms consistent with this syndrome. A 2008 congressionally mandated Research Advisory Committee on Gulf War Veterans' Illnesses, composed of independent researchers, published a report concluding that Gulf War illness is a real condition with physiological basis. The report found that exposures to pyridostigmine bromide pills and to pesticides used during the deployment were likely contributors. It specifically noted that the combination of PB and certain pesticide exposures appeared, in animal studies, to produce synergistic neurotoxic effects. The DoD and VA have, over time, moved from initial skepticism about Gulf War illness toward formal recognition. The VA currently lists it as a service-connected condition for disability purposes, without requiring veterans to prove a specific exposure link. Pyridostigmine bromide was not FDA approved for the use to which it was being put. The FDA granted a waiver allowing the military to administer it without obtaining individual informed consent from service members. The waiver required that records be kept of which service members received the drug. A 1994 General Accounting Office report found that those records were inadequate. In some units, it could not be determined from existing documentation who received the drug or at what dose. This gap has complicated efforts to study PB's contribution to Gulf War illness by making it impossible to construct accurate exposure cohorts for research purposes. Skull Valley. Concurrent with Project Shad's naval testing, the Army conducted a parallel land-based chemical and biological testing program designated Project 112. The program involved field trials at various domestic and international locations. Project 112 tests were conducted at sites including Dugway Proving Ground in Utah, the Pine Bluff Arsenal in Arkansas, and locations outside the continental United States. Tests involved the release of chemical and biological agents, including VX nerve agent, GB or sarin, and various biological materials, to assess dispersion, environmental persistence, and potential effects. One of the more specifically documented incidents under this program occurred in March 1968 at Dugway Proving Ground. An aircraft conducting a VX spray test experienced a malfunction. The agent was released at an altitude and in quantities that exceeded planned parameters. In the weeks that followed, approximately 6,000 sheep died in the Skull Valley area adjacent to Dugway. The Army denied responsibility initially, but internal documents released in subsequent years acknowledged the connection. The Army officially accepted financial responsibility for the Skull Valley sheep deaths in 1969, paying claims to affected ranchers. Congressional hearings followed. Internal documents relating to the Dugway VX incident show that Army investigators concluded the VX release was the probable cause. The Army's own environmental impact statement for Dugway, published years later, referenced the 1968 incident directly. The Army acknowledged the Skull Valley incident as the result of a testing malfunction and compensated ranchers. Project 112's existence was acknowledged by the DoD in 2000 as part of the same disclosure process that revealed SHAD. The DoD has provided records to veterans who participated in Project 112 tests and extended healthcare access. What the Skull Valley documentation does not fully account for is the timeline of the Army's initial public denials versus when internal investigators concluded the VX connection was likely. The gap between the internal finding and the external acknowledgement, during which public statements attributed the sheep deaths to other causes, has never been formally explained in the released records. There are also Project 112 tests conducted in locations including Alaska, Hawaii, and certain Pacific sites for which complete test reports have not been released. Volunteer soldiers. Edgewood Arsenal in Maryland was the Army's primary chemical warfare research facility from World War I onward. Beginning in the mid-1950s, it ran a formal human research program in which volunteer military personnel were tested with chemical agents as part of the Army's effort to develop antidotes, treatments, and defensive equipment. Between 1955 and 1975, an estimated 7,000 soldiers participated in experiments at Edgewood Arsenal. Subjects were exposed to chemical warfare agents, including mustard gas, nerve agents, and a range of psychochemical compounds, most notably BZ, a dissociative incapacitating agent that the Army was developing as a potential battlefield weapon. Participants were also tested with LSD, PCP, and various sedatives and stimulants. Soldiers volunteered for what were described as medical studies. The degree to which the specific nature of what they were receiving was disclosed varied by compound and by period. Army records indicate that the consent process for psychochemical testing was less complete than for some other categories of testing. The Edgewood program is documented in Army records and was the subject of congressional examination during the same 1977 Senate hearings that reviewed MK-Ultra. The Army acknowledged approximately 7,000 participants. In 2003, veterans filed a class action lawsuit. A federal judge ruled in 2009 that the Army had a legal duty to warn former test subjects about potential health risks and to provide follow-up medical care. The Army subsequently established a notification and health referral program, though veterans groups argued the outreach was inadequate. The Army has maintained that participants were volunteers and that the program operated within the regulatory framework applicable at the time. The 2009 court ruling, however, specifically found that the Army had not adequately fulfilled its obligation to former participants. The Edgewood human records, the actual experimental data compiled from the 7,000 participants over 20 years, have not been fully released. Veterans and their physicians have reported difficulty obtaining specific records of what individual soldiers were given. In some cases, veterans seeking medical evaluation for conditions they attribute to Edgewood exposure have been unable to obtain documentation specifying which compounds they received at which doses. The Army's position has been that some records are incomplete. Whether that incompleteness reflects records never created, records destroyed, or records still classified, has not been formally clarified.